Good afternoon. Thank you all for joining us here today. My name is Dr. Alex Chevalier. I'm a child and adolescent psychiatrist. I'm also the medical director of the Adolescent program here at SunCloud Health. Just going to cover a couple background things on us real quick while people are trickling in. Thank you all for taking your time to join us on this holiday, for which many of you had, I'm sure, more exciting things you could be doing over lunch. So thanks so much for being here. Today I'm going to be talking about adolescent cannabis, the modern trends, the risks, and what treatment looks like. And this is going to be, kind of a whirlwind pace tour of this. This topic I could easily talk on for 5-6 hours at a clip, and so condensing it into about 45 minutes is a little bit of a trick. A real target audience here today is going to be, therapists, counselors, psychologists, people on the front lines working with our adolescents all across the Chicagoland area. And I'm going to assume some baseline level of knowledge, and also try to get into the weeds a little bit, just because I think it's really important that you all know what's actually going on. I'm certainly going to do my best to save some time, and I'm happy to answer any questions that come up along the way. Love to have a discussion about anything that resonates with folks at the end. I'm going to get all the messages that you send into the chat, and I'll just read those questions off and then answer them, and we can have some back and forth if that works out. So before I get started, SunCloud Health is a mental health treatment center that focuses on PHP and IOP care for our adolescents. We have 3 locations in Chicago, Northbrook, where I'm standing right now, and the Naperville locations. We do quite a bit of work in the substance use disorder space. It's a space that is unfortunately really underserved in the Chicagoland area for adolescents. Most of the higher level of cares and substance use focuses on adults, which is a real shame, and an area that we're trying to help on. We also do a lot of work with eating disorders, trauma disorders, mood disorders, and anxiety disorders. And I'll have a little bit of information about SunCloud for those of you who are not familiar with us at the end. Also, before I get started here today, I just want to take a chance to thank everybody who's on this call. You guys do such incredible and important work, and I think it's certainly no shock to anybody here that it's not for the paycheck. And so thank you so much for what you do if nobody's thanked you anytime in the last day or week or month or anything like that. So getting to cannabis here, I want to talk a little bit to you about the substance, the drug itself, how it interacts with common things that you're going to be seeing in your adolescence, and what we do about treatment for it. So just to give you a little bit of background, marijuana is the common name that's given to cannabis for the psychoactive component, and there are many of those. THC, tetrahydrocannabinol is number 9, is the main topic that we're going to be discussing on today. However, there are greater than 80 psychoactive components to marijuana, and what we've increasingly seen with the laws and regulation around delta-9 THC is that other substrates that are psychoactive are being created. In particular, many of you may have heard about delta-8 THC. That's something that's available, unfortunately, in gas stations all across the country, in the boardwalk in Key West, I know from personal experience, and is something that's pretty ubiquitous. There are starting to be laws and regulation around that, and so they've actually shifted to delta-10 THC as well. So if you're seeing any of those come up, those are going to be the psychoactive components of marijuana, and we'll of course talk about what that means. The interesting thing about cannabis in comparison to many of our other substances is that while it has use that dates back for thousands of years, much less is known about it. If you're talking about cocaine, methamphetamine, PCP, fentanyl, heroin, many of these substances are very, very well delineated and understood, and we could have exact conversations on exactly what happens when you take them. That is absolutely not the case in the cannabis world. There's been a relative dearth of research into it, largely because the war of drugs in America that everybody thinks is very U.S. centered, especially myself as an American, thought was the case. It turns out really most of the entire world banned a lot of cannabis research for quite a bit of time, around the same time that people were really coming down on its use. And so we just don't have the same amount of science. That is certainly changing and giving us some more clues and knowledge, and we're going to touch on some of that here today. So when you think about the endocannabinoid system, it's important to understand that it is really throughout the whole body, right? We're going to, of course, be talking about the brain. I'm a brain doctor. I will not profess to know a ton about other areas of the body, and I'm not going to get into that at length today. But for example, something like smoking marijuana affects your sperm production as a male and your sperm motility. This is, just to give you a range of the widespread effects of this substance. It certainly has significant impacts in the GI system. And it causes issues with appetite, loss of appetite, nausea, vomiting, things like that. But it really affects the entire body It affects the immune system, it affects bones, solid organs, prominently the brain, but this is not a small thing that's just isolated to the brain. We're not talking about a substance that's affecting one neurotransmitter somewhere. This is very diffuse and systemic effects, like I mentioned, many of which are not known. And just to cut to the chase, and we're going to talk a little bit more about the kind of easier parts of this later, this is a really important topic in adolescents in particular. THC in adolescents in comparison to THC use in adults has differential effects. And I think this is one of the most important points of the entire conversation, and the thing I think is least understood by people who are talking about this, certainly when adults talk about it, because it doesn't have the same effects on them as it does on adolescents. We know with very clear science and research these days, and we're going to get into some more of these studies, that THC is actually affecting how the brain goes about its development in adolescence. Keeping in mind that adolescence, the number one event that's going on is brain maturation, right? If for females from ages 12 to 22, males roughly 13 to 26, maybe a little bit later, the number one thing happening in their world, their life, is the maturation from a childhood brain to an adult brain. And that process requires neuroplasticity. It requires making new connections between neurons. We know that's downregulated and impacted by marijuana. And also, probably even more importantly, is that there's big pruning events going on where synapses that should not be connected to each other are cut. And this increases the efficiency of the brain and allows our brains to go from slow computers to supercomputers. That process is also significantly impacted by cannabis use in adolescence. In addition to that, cannabis is affecting the overall neuroexcitatory and neurodepressant effects, and that's glutamate and GABA respectively. And those effects, combined between the two of those, are having significant effects on how the adolescent brain is functioning. Let me tell you a little bit now about how THC has changed. So when I was growing up as a kid, the rare kids who were using cannabis at my school were maybe getting behind the bleachers and getting together and huddling around and sharing a joint. Right? That cannabis in that joint was running around 5% THC by concentration, and that's just what it was. That was what everybody thought marijuana was, right? And that really was what marijuana was. There wasn't a whole lot of other ways of consuming the substance. And that was obviously not an efficient delivery system, but I guess based on some of my colleagues in high school, it got the job done. If you fast forward to present day, marijuana looks completely different. The concentration of THC in marijuana is very hard to find under 20% in the US. Because of legalization and because of how good our agronomists, our plant scientists are, we've been able to go from that roughly 5%, and able to, I guess should be in quotes, to 20 to 25% in the standard plant, right? So if we replaced, everybody's Budweiser with Fireball, that's kind of the change that you're looking at when you're thinking about how things went from 20 years ago to present day. Now, this has been something where people have been saying, it turns out that most effects of substances are dose dependent, right? And we know this for everything. If you smoke 2 packs of cigarettes a day, definitely changes your likelihood of having lung cancer versus smoking 1 pack a day. If you drink 30 beers a day, it's a lot different effect on your body than drinking 5 beers a day, or if you're drinking 1 beer a day. So not a huge surprise that when we crank up 400 or 500% increases in plant concentrations of THC, that this is going to have different effects. And this is part of the reason why the research is so nascent, because we've never had these products until recently. And it turns out that potency matters. If you take a look at individuals who are using higher potency THC in adolescence, those that have higher concentrations had higher incidence of depression and higher incidence of anxiety as well. Right? And in addition to that, people that are using higher potency THC also had much higher rates of running into addiction issues with THC. Again, not a big surprise, but if you haven't sat down and thought about it, it's an important thing to take away. Another big change recently, and people have known for a long time that there's been this association between cannabis and psychosis. Psychiatrists are kind of bombarded with this because certainly in the adult psychiatry space, a big specialization of our field is dealing with schizophrenia spectrum disorders. And the link between that and cannabis has been kind of well and long known. What's changed, of course, in that space is that as you've had higher potency THC, and as you can see on the right bars on that second, on the right side slide, that the higher potency daily use of THC is further increasing the odds rates of having more psychotic symptoms and more concerns. And so the link between adolescent cannabis use and emerging psychosis is also kind of a changing and evolving field. We used to think that there was just this association of saying if you use THC, it's causing somebody who's already going to have schizophrenia have that occur earlier. Now we're starting to think with these high potency THCs that there's some pretty good evidence that it's causing people to have psychotic disorders who are never going to have them in the first place. Truly one of the scariest things about adolescent cannabis use. Now, that's the plant matter itself, and I think it's an important thing to understand. But if you spend any time along with adolescents, I would estimate that certainly at most in the single-digit percentages of cannabis is being consumed by smoking the plant itself. The days of joints and bongs being the dominant culture of cannabis are far, far behind us at this point. Nowadays, basically, the overwhelming majority of what you see is going to come in the form of vaping. Right? This is sometimes referred to as dabbing as well. This is when you use a wax-based substrate that is heated up with an internal heater that's run off of a battery. And that concentrate in the past, and I'm going to show you some slides on this, they were pretty excited. They were able to get it to 70-80%. Nowadays, again, with the advent of big money behind this, legalization and high-level scientists, it is pretty typical for these pens to run around 100% concentration, certainly above 90%, and many places are producing 100%. Even the knockoff ones that are like kind of getting dropped off a boat from China are still running about 80% concentration these days. The big game changer because of vaping are several things. I think this is, again, a second most critical point to understand. Because vaping THC does not have the same smell, it does have certainly an odor to it, but it dissipates very rapidly and it does not linger like smoking the plant matter, right? It was no surprise to anybody who the kids in my high school class were that were using marijuana, right? There's a small number of them, and it was very clear when you walked past them what was going on. Nobody was confused as to what the situation was. Nowadays, you have lots of folks who are using extremely high doses of THC, and families, schools, even friends are not even always aware of what's going on because of the change in how it's consumed and the change in odor. The other problem is these pens are very portable, right? It was somewhat of a big deal to kind of like get this plant matter and grind it up and turn it into something, and even a joint's kind of like easy to break. It can't get it wet. There's all these problems with it. These pens can be stored in, underwear, pockets, bras, kept really anywhere. And most of the adolescents that I know, that have any issues with this say they tell us they're going to search us ahead of time. It's a trivial thing for me, to hide this in a place that they're not going to be able to get. And it makes no difference to me how many times they search me. They're never going to find my pen because they're not going to touch me, in certain areas. And this has really led to difficulties with schools cracking down on using this, illegal substance in their school, something that previously was just not a normal expected thing. Like, you didn't go to school and do drugs, and if you did, there were going to be consequences to it. Now, many schools, it sort of seems like, have almost felt like they're defeated, that they don't know what they can do about it and how to turn things around. The other big change with vaping, in addition to its ease of use, the limited odor, is the fact that you can move these huge numbers of doses for much less money. So not only is it more convenient to take a pen that might have, as much cannabis as like a pound of like the physical plant matter, but the price per milligram of consumption has dropped dramatically, right? It's as if when you were in high school and you had to get enough money to get beer for people who drank, that was a big deal. You had to find the money for it. It wasn't a trivial thing. Maybe you spent $1 or something like that per beer. It's as if the price of a beer went down to a nickel, right, from $1. And if you have these 20-fold reductions in price to get high, it's not a big surprise that you're going to see more use of the substance. There have been a lot of marketing campaigns that have been targeted at this change to promote these products. They're still very high profit market products. Juul, for example, recently was involved in a lawsuit related to how they were advertising products using images designed to pull in kids, much like we've seen with tobacco in the past, with menthols, with Joe Cool, things like that. That settlement, at least in its initial stages, settled for approximately $500 million and is still an ongoing area. If you take a look at, again, what these pods are going to look like, Juuls for nicotine have very high concentrations of nicotine, and this isn't a conversation about nicotine vaping, although that could be a great topic for another day. But you found that they were really able to push the concentration limits back when they were working on the initial vaporizing technologies, and then they've moved that over to cannabis, and as I mentioned, nowadays we're finding these 100% pure THCs. Just to give you some interesting context, Amsterdam, I think one of the places most famous in the entire world for having legalized or at least decriminalized cannabis use. Some place that, I was watching Eurotrip, I think 20 years ago, and this is the butt of all the jokes about this, and everybody knows about Amsterdam and their permissive use of THC dating back for decades, and that very place has classified cannabis use over 15%, as a hard drug as opposed to something that they agree with and are permissive of. So when we think about how it's consumed, of course, as I mentioned, the cannabis industry has gotten a lot of funding. There's a lot of money being made, and so we've moved even beyond just the vaporized forms. We also have lots of edible forms, lollipop forms. It is getting increasingly common to find it in beverages. There's more crossover with the alcoholic beer beverage industry and cannabis. I don't have that posted here, but has increased. And basically just any way to consume it. It's sold in cookie form. I have Pop-Tarts up there, but it's certainly sold in many forms in which you can just directly eat it. Again, these marketing campaigns are really going after being cool, being young, being trendy. They're bragging about how high of potency they can get. If you see on that right slide, that was 72% concentration, and that was a winner. That was a handful of years ago. Nowadays, that would be a bottom barrel vape cartridge. And just to give you some idea about how rapidly this technology, has progressed, this is just all in the span of a handful of years that we've been seeing this stuff evolve and get more and more potent and drive down in price, frankly. So thinking a little bit about some raw objective data on the numbers, Monitoring the Future has been around for ages, done through University of Michigan and some other folks across the country. I believe I got one of these surveys when I was in high school, and it far predates myself. Even just giving you the most recent numbers, we've got 2022 data that just came out. If you take a look at 12th graders, 30% used in the past year, 20% in the past month, and 6.3% daily. Right, so that's really telling you that 1 in 5 of our high school students on self-report, right, that they're admitting of their own free will, not based on testing or anything like that. So if anything, that number is almost assuredly on the lower end of what would be accurate, as you can imagine reasons for somebody to underreport their use on a survey, like ego protection and things of that nature. You're still looking at kind of a bare bones thing of 1 of 5 of our graduating class using in the last month alone. In 10th grade, data is at 20%, 12%, and 2%. And in 8th grade, 8%, 5%, and 0.7%. So you can really see a real escalation over the course of high school where cannabis use is going from being a pretty fringe thing, although 1 in 28th graders is still kind of a mind-blowing number to me. But to go from that to where you're at by the time you're in high school, where the normalization has already begun, is pretty clear. These numbers have held relatively steady over the last couple of years, but I certainly think that they're very, very high and very concerning at the levels that they're at alone. The fact that they're not going up gives me a tiny bit of reassurance, but it's certainly nothing exciting about the fact that 6.3% are using on a daily basis and 20% on a monthly basis. As I've kind of alluded to in the past, we've obviously seen big changes related to legalization of cannabis. This is obviously not a conversation on whether or not that's a good thing, bad thing, or anything like that. But a lot of the legalization efforts just really ignored the impact on kids. And frankly, as a child and adolescent psychiatrist, that's all I care about. And so as we've had more legalization come underway, we've seen increased use in places where legalization has happened. When you kind of take a look at, places that went from not having legalization to having legalization and then testing pre and post cannabis use, you've seen increases almost across the board. Teens will tell you how much more accessible it is. I hear that on a daily basis from my patients. Of course, the ways that we're using cannabis, as we've already discussed, have changed, and those changes have been accelerated and facilitated by the legalization. And really, there's this overall decreased perception that marijuana is harmful. There's really, if you take a look at U.S. population and ask them about their thoughts on legalization, about marijuana harm, there's never been more support for legalization, and there's never been less concern about the harms for marijuana. And again, while the discussion on adult marijuana use is not the purpose of this conversation here today, that is what has dominated the conversation, and the conversations about what's happening with our youth has been all but completely absent from this conversation. And certainly we've already seen increases in cannabis-related ED visits, hospitalizations, motor vehicle crashes. I had a patient recently who was taken out of school on a stretcher after overdosing on cannabis gummies. And that was a real trauma for them, and greatly impacted and changed the trajectory of their life following that day at school. So the main event here that I really want to talk to you about, and I think is, again, an area that we just do not discuss enough, is what does THC do to the adolescent brain, right? And we've got a couple big studies that have been really nice to kind of get at this a bit more. I'm going to talk about this one here from 2008. It's published in the Green Journal, which is kind of a big-time journal in psychiatry. And this was looking in Canada, where they could track a cohort of 4,000 seventh graders and assess them for their alcohol and marijuana use over a 3-year duration, right? So just getting into the beginning of high school years here. And really right at the crux of that age 12 when adult neurodevelopment starts to take off, right? So big takeaways, and again, this isn't to talk on alcohol, it's a very brief mention of it here, but using either substance did result in the short term of decreasing working memory, lowering inhibition, lowering perceptual reasoning, and causing poorer academic functioning. I don't think anybody who spent time around adolescents using alcohol or cannabis would be surprised that if they came to school or at school intoxicated on those substances, or the day or two after they used, that they were going to have some of those problems. But of course, that's what they saw in this big population study. Secondly, the big finding was that cannabis, but not alcohol, caused reductions in delayed memory recall and perceptual reasoning. And this goes back to those previous studies that were done that showed the impairments in neuroplasticity. And the third finding that they had is that the neurotoxic effects of cannabis were persistent over time, right? And so this was not just an acute intoxication effect. They, in fact, specifically tracked adolescents who used and then tracked them after they stopped using. And we continued to see impairments in working memory and inhibitory control a year later. Right? And so this is consistent with the previous research that has shown long-term, aka permanent reductions in intelligence and executive functioning with teenagers who have used chronically. There were some really big seminal studies out of Australia years back that kind of showed this. And at the time, that study was based on adolescents in the heavy use category, which was using 3 to 4 times a week. And I got to tell you, from the work I do, I see patients where they're using 3 to 4 times before they get to noon on a Monday. So these negative, permanent, lifetime effects on intellectual functioning, executive functioning, all the things that we kind of think about, that we associate with cannabis, it's not just the acute intoxication effect. That's very low on lists of concerns of mine, unless somebody's driving or using heavy machinery or things like that. It's these permanent effects that we don't get a second do-over for, that we don't get to, rechange your neurodevelopment on. I think that is the biggest concern. So there have been many studies about this over time. We've seen dose-dependent impacts. And again, that's those types of studies that are showing that, if you smoke 2 packs of cigarettes a day versus 1 pack versus 5 cigarettes a day, that you have this, dose-dependent relationship on higher rates of heart attacks and strokes and lung cancer. That was the data, that dose dependency that, kind of changed the world with how we viewed tobacco and how we thought about drugs. They're finding those same dose-dependent impacts on academics, occupational, so being able to do your job for teenagers that are working, cognitive, mental health outcomes, depression, anxiety. We'll talk about those, and then other addiction issues with how much THC is being consumed. And as I mentioned, just the overall rate of consumption of THC, not the number of people consuming, but those who are consuming, has just increased so dramatically that these dose-dependent impacts, I think there's very just very nascent in the research about seeing what it's really like for that kid, who's having 100 milligrams of THC ingested a day, every day, what he's going to look like 10 years down the road, he or she, sorry, is certainly unknowable. We just haven't had the products around long enough to actually have any cohort to track it for. But I think the spoiler alert is that not good is going to be the summary of that data, but it'll be obviously nice when we have some more concrete numbers to present on these types of things. As I mentioned before, cannabis use in adolescents is absolutely associated with an increased incidence and worsened course of psychosis, but additionally mood and anxiety disorders. We're going to touch on that a bit more because those are so omnipresent in the adolescent population. And then very worryingly, also increased suicidality has been a very consistent finding with adolescent cannabis use. Right? And again, just to make this real brief point here, and I'm not going to get into adult cannabis use much, I'm frankly not an expert in that and don't have interest in diving in, but there has absolutely been research to show there's a differential effect in adults that are using cannabis, and that the side effects and adverse effects for adults are basically assuredly less than they are in adolescents, despite this just not being an area that we talk on much. All right. So real quick, let's just talk a little bit about major depressive disorder. Don't want to spend a whole lot of time on this. I know you guys know depression real well who are on this call and listening to here today. But based on 2020 data, and the numbers have only gotten worse since then, 17% of adolescents have had one or more major depressive episodes. It's just between the ages of 12 and 17. I think a lot of people are worried that the number is going to be close to 1 in 5 with where things are going, and it's certainly trending in that in that direction. And even 12%, so 1 in 8 adolescents, severe impairment from their depression, struggles getting up in the morning to get to school, being in hospitals related to suicidality, severe self-harm, dropping out of sports, dropping down in grades, those kind of things. And even amongst those individuals who have those severe impairments, only half of them are getting treatment, which is, of course, a real crime. In our country with the resources that we have. Keep in mind here that in adolescents, females are actually significantly more likely than males to have depressive episodes. This gap has actually widened since I was an adolescent myself. And the demographics vary dramatically about who's having these depressive episodes. So the single highest risk group are individuals who have more than one race, and whites, incidentally enough, are the second highest group when you take a look at adolescent depression. Part of the sub-breakdown on this data is that it turns out in the past we often associated much of mental illness in adolescence to individuals on the lower socioeconomic status, and for good reason. Those kids face a lot of challenges and absolutely do have a lot of struggles, but it has turned out that in recent years, actually the kids at the highest social economic status at the best schools and the most competitive schools have significantly higher rates of depression and anxiety than their same race peers that are at kind of more middle of the road average schools. And so we've very clearly seen an effect on adolescent mental health that would start to bridge into a philosophy and law and other debate about what is going on in that group. And that is a big part of the reason why, obviously with the racial inequity in this country, that whites have the second highest rate of major depression. Again, everybody in this call has an idea about depression. Certainly not going to read you the SIGI CAPS criteria or anything like that, but just keeping in mind that adolescent depression, right, characteristically has irritable mood. That's the one place in the DSM where we said, hey, we're not going to just copy the criteria from adult and paste it over for the pediatric population. We're actually going to say there can be this difference with this irritability and mood, right? And for kids, you're often seeing this withdrawal from school, from activities, problems with school performance, not getting out of bed and going to school, increasing isolation, lots of time on phones, social media, screens, that kind of thing. Right? And the coping strategies that adolescents can do are a lot different than adults, right? You cannot say, hey, I'm having a really tough go, let's go for a week to the Keys, right? You cannot, in many cases, say, hey, I'm having an awful experience at the school, this is bullying, borderline, illegal things that are being done to me, I need a different school. You often don't have the ability to even transport yourself to the things you'd want to do. Maybe you love doing, hot yoga, but the closest place is 5 miles away, and your bike's not getting you there, and pretty hard to find a way to make that happen for a lot of kids across the country. And overall, as an adolescent, and again, I know you guys all know this probably even better than me, you lack control, right? So you're being placed with higher and higher expectations, higher and higher demands. You have to get ready to go out into the real world. You have to be doing X, Y, Z, but you don't have a lot of control, and it makes it a very challenging time when you're stacking depressive symptoms on top of that. So what do kids do that are having depressive symptoms? They're very characteristic in what they do. We see suicidal ideation very commonly in this age range. They're the second highest group of increased suicidal rates and unfortunately completions. We see a lot of self-injurious behavior where adolescents sometimes feel like they can feel something as a result of cutting, burning, hurting themselves. In some cases, they feel like they can channel what they're feeling into something physical, and it provides them a temporary relief. Many of the adolescents I work with, unfortunately, have self-injurious behavior really as a method to punish themselves, which is a self-reinforcing way of making depression worse. And then, honestly, one of the most common ways that all people deal with depression, unfortunately, especially in American society, is using substances, right? And these can help us feel numb, to relax, to feel like we're our old self, to forget about the fact that we're struggling with our mental health, difficulties here. People sometimes use this word self-medication in like a pejorative kind of way, but this is absolutely a thing that you see, on a regular basis. Anybody who does addictionology work, at any stage in the life cycle will see let's take a timeline of what happened. I was feeling really down. The one thing that made me feel better was getting high. Shockingly, they go and get high, more as a result of that. Right. And then, of course, in the work that we do here at SunCloud, we also see a lot of disordered eating to have control, feel like you're making progress at something or prove yourself through changes in your physical appearance. Right. So GAD, real quick, interestingly, is a little bit like cannabis in that we have really scarce data on GAD. GAD is actually a somewhat controversial diagnosis these days. Everybody agrees it exists, but whether or not it exists in a very high percentage of individuals versus a much lower percentage, previous data 20 years ago were showing it at 2.2%. More recent data in Norway, a place known for extremely good health outcomes, I will add, and has a very healthy populace, had rates at 4.51% in 14-year-olds even. And so, I think a lot of people are saying what's actually going on with this in the US. If you talk to the average 16, 17, 18-year-old, the number of them that are up late at night, having problems with irritability, muscle stiffness, trouble sleeping, headaches, stomach aches, being on edge because they're worried about what college they're going to get into, what their grades are, if they can provide enough for themselves, if they can buy a home in the future. I think it'd be very hard to say that number is anywhere resembling 2% anymore, but it is just not well studied in the US. Again, all of you know GAD symptoms. I'm going to blow right past that and talk to you a little bit, what happens when you're feeling like that all the time, right? You're worried about the future, you're worried about global warming, you're worried about being liked by your peers, you're worried about your parents' expectations, right? Our current teenagers are the first generation in the history of America to be born to parents who are doing worse than their parents, right? And so they get parents that say, you got to do this. You have to get that grade. You have to get it into an Ivy League school in order to secure your spot in this increasingly competitive landscape. And anybody who frankly tells you that it's not getting increasingly competitive in this country is just lying to you. And so this is not anxiety based on, arbitrary things because 17-year-olds are getting irrational. This is based on real data and what's actually happening in the world and the experience of them, coming from their parents' generation, frankly, my generation. There are going to be issues with sleep, concentration, irritability, fatigue as a result of these anxieties. And frankly, nobody really wants to spend a bunch of time with somebody who's known to be really anxious and on edge all the time, right? So what do kids do? It was going to show you about the role of central nervous system depressants in helping kids feel like they can be normal, that they can be chill, to not feel that being on edge all the time. This is one study to show that. I apologize, I was missing a slide in there, of a 2011 Finnish study. So this is already a decade plus old, but taking a look at thousands of adolescents again, and these are in Norwegian countries that have unified healthcare systems where they can really get perfect population data. They were taking a look at GAD in early adolescence, and in those instances, it preceded the substance use of alcohol and cannabis, and they did a whole bunch of stuff to control for confounders. GAD use prior, when they're catching these kids early, increased the likelihood of alcohol use by threefold, 300%. Right? And those that had GAD and then went on to use alcohol were more likely to continue to drink than those who didn't have GAD in the first place, which means, of course, that when the substance actually is solving a problem that you have in your life, it's not solving it, but it's improving it for a few minutes, few hours, you're more likely to go on to use it, right? This is evidence of the self-medicating working, description being an actual thing that is what's literally going on, right? The same things exist for cannabis, although with GAD, because it's understudied, I don't have great data to show you. But certainly we know that the central nervous system depressants, principally alcohol and marijuana, are used much more frequently in adolescents who are struggling with both generalized and social anxiety. Separately, I think OCD is an area that doesn't get touched on enough for this too, because for kids who are suffering with severe obsessive thoughts, alcohol and cannabis can feel like the only way forward. And so we certainly see patients that fall into that bucket as well. I wish I had better studies for you, but I hope you can take my word for it. That's certainly the case. So I just want to put this all together, take a step back from where we're at. Cannabis absolutely is an addictive substance, right? If you take a look at neuroimaging studies and take a look at what happens when people consume cannabis, it activates the nucleus accumbens using the dopamine signaling in the brain. That's the center of the brain, that works and tells your body what to pay attention to, right? And that's the centralized pathway for addiction across alcohol, nicotine, cannabis, heroin, cocaine, et cetera, and even other substances that are prescribed by physicians. Right? And so cannabis is working on that pathway, and it's causing issues with its addiction and telling the brain, you need to search this out more, and it's going through that. But in addition to that, right, there are the active effects of cannabis, which are reducing the symptoms of depression and anxiety. Right? When you have, for those of you who haven't taken, Psychology 101 lately, negative reinforcement is the removal of an aversive stimuli. Right? So if you are on your feet all day, you had a super long day, you're running up and down, you've been doing stuff, and you finally sit down and you put your feet up, you feel that tingling in your feet and the relief of the pain that you were feeling, that is negative reinforcement, and that is the most powerful type of reinforcement for the human brain. Right? And so THC is doing the same thing for depression and anxiety, and it does it quick. Right? Edibles, not so quick, but certainly with vaporized and smoked cannabis, we're talking in the span of like seconds to a few minutes, that wave of relief is coming on. Right? The chronic effects of cannabis then go on to cause those disruptions we were talking about, cause issues with the GABA and glutamate system, cause issues with the pruning and the neurodevelopment of the brain, and those changes cause further depressive and anxious symptoms. So you've got a substance which is causing you to seek it out and crave it. You've got a substance which in the moment gives you a relief from these negative things. And then you have a substance that when you continue using it, it makes the negative thing that you were trying to get relief from worse. And of course, what does your brain learn to do to treat the depression and anxiety? It's learned to use more cannabis. And so I see, on a day in, day out basis, kids start, they use a little bit, maybe it resonates with them, maybe it doesn't. They start using more, it resonates more with them. Then they have more problems, so then they use more, right? And this is the classic way that many different substances of addiction work, and it's certainly the way that cannabis works. Right. Tell you real quickly a little bit here about like the concept of pre-addiction. I think this is an important thing, and we don't have a lot of time left, but just want to touch on, when we think about how teenagers use substances, there's always this conversation about, oh, hi, this person is experimenting, they're dabbling or trying out the substance, right? And I cannot tell you how many parents and even kids are like, oh yeah, this is like what I'm supposed to do as a teenager, right? The problem is that when you use these substances at an early age, they have an outsized effect on all the things that we were just talking about, right? In addition to the long-term changes, if you're using chronically, even in the short term and even with smaller amounts of use, those early effects on the nucleus accumbens from the substances of addiction, they prime it. And so they make it so that when you have access to other substances in the future that go on to activate the same addiction pathways, that they have a larger effect than they otherwise would have. Right? And so we routinely run into people who are talking about like, hey, it's not a big deal, my kid does this once in a while, and it may not. It may not, certainly not 100% of those kids are gonna go on to have problems with substances, not gonna 100% of them are gonna go on to have problems, with executive functioning and intelligence tasks. But there is a real subset of those individuals who find themselves, having a favorable experience. Sure, they're only using when they're with their friends, but, hey, they're a teenager, that's every weekend. Right? And while they can stop and they don't necessarily have tolerance or withdrawal, they're actually building the foundation for them to have more problems with substances down the road and get themselves into a dark place, like say when they get to college or young adulthood. Right? And then just beneath all of that, just to cover real quickly, what we absolutely know from more and more research is that things like trauma, epigenetics, which for those of you who don't know are the changes to the methylation and carbylation or carboxylation groups on the DNA that happen when a child has already been formed in the utero. And so that's not the physical ATCG, connections in the genetics, but how those genetic codes are expressed based on these small molecules that sit on and kind of turn on and turn off the DNA. And those are passed on, from mom to child. Those can be passed on, through adverse childhood experiences, and this is the way in which, kind of there's an old thought of like, does a giraffe's neck, get longer based on, having to bend and having to reach higher and higher levels, and people were like, no, that, obviously that can't be the case. That something that's happening during the giraffe's life is changing its genes to make its neck longer. What they didn't know is that, female giraffes whose necks had to get longer to reach things were having epigenetic changes that were actually going on to influence the genetics of the next generation. And so, I think it was Lamarck, please forgive me on the scientist who was, thought to, he was laughed off the world, but it turns out these things actually exist, and this is what's actually going on. And all of those trauma, intergenerational trauma, systemic racism, traumas, adverse childhood experiences, those go on to greatly affect depression, anxiety, rewards, and all of those things put together have a huge impact on what happens when we come to the idea of what substances kids are going to use and how likely they are to fall prey to addiction. Right. Just to give you a little bit of hope before we wrap things up here, this is a slide showing what abstinence looks like for adolescents who are using cannabis, and it shows you, what incredible changes can occur even in the span of 3 weeks, 4 weeks, right? On that working memory area, you see that after 3 weeks, kids were back to the same as people who weren't using. On verbal memory, a little bit lower, but a huge percentage of the deficit caused from cannabis improved, and the same thing for attention, right? When you take a look at depressive symptoms, you see a rapid decline in depressive symptoms following abstinence, and anxiety symptoms, same thing. You're not getting quite to the control in the anxiety symptoms after a month, but if you were to run that out, the likelihood that would get better over the next 3-6 months kind of space and get back to control is pretty high. Of course, we've talked about some of the doom and gloom about the long-term permanent changes that can affect from cannabis, but there's absolutely big changes that abstinence can cause, and you can reverse a lot of the harm, and particularly the sooner you're intervening, right? Just a bigger slide to kind of talk to you about what it's like when you're in treatment and getting sober, and how that makes your depressive symptoms go. Right. So when we think about treatment for these and a little bit of what we're doing here at SunCloud, a big part of what we're working on is psychoeducation. I think very, very few patients and families understand what's actually happening with THC in the adolescent brain and the critical nature about cessation and abstinence around that. Second thing is about promoting abstinence in a supportive community. It is very hard to be abstinent on your own. Isolation is very difficult for most mental health disorders, and is absolutely very difficult for individuals trying to be abstinent. So a lot of it is getting somebody into a supportive recovery community, helping kids put up boundaries with friends who are using, and finding sober compatriots that they can spend time with and enjoy spending time with. Certainly for kids that have alcohol, opioid, and nicotine use disorders, we have meds for them, but unfortunately for cannabis use disorders, we really don't. The one exception to that is N-acetylcysteine, or NAC. That has had some preliminary research, some good research done by titans in the adolescent addiction space, show small effect sizes for helping with THC cessation. So that is something that you'll see kind of adolescent addictionologists use. It's for good reason. The risks are profoundly low. The benefit's not huge, but even if you can eke a small benefit for basically no risk, the risk to reward benefit ratio is pretty good. But this is certainly an ongoing area of active research. A big part of treatment is helping individuals develop an identity of their sober self. For many individuals, cannabis use is not, just an addictive thing or just self-medication. It actually becomes like their personality. They identify, with the stoner lifestyle, with stoner culture. They identify, with the other people who use, and it's a big part of their core self. And so that's a real interesting task to work on changing that. Certainly, fostering those connections to healthy peers, peer recovery networks, family members, that can be supportive. And then, of course, competent treatment providers makes a big difference. And then, as I was mentioning, in many of these cases, substance use disorders are emerging out of adolescents who are already really struggling with something, right? And so it's a big mistake to say, like, oh, look, this cannabis use, it's a real significant concern. We need to put 100% of our energy at that, right? It is a real significant concern, more than 99.9% of the population know, but you really need to also go after what was bringing on that cannabis use in the first place, right? We certainly work to target symptoms of anxiety and depression in treatment, whether that's through pharmacology, whether it's through targeted psychotherapy skills, affectionately referred to as coping skills, which is, I guess, the most popular two words to put together when you're talking about adolescent treatment. And from my end, I think a big part of it too is kind of the holistic improvements, which are, the things that actually have science and research behind them. Getting good sleep, working on ways to make that happen, eating, consistent and balanced meals throughout the day, engaging in joyful movement that helps your brain out. And then, of course, having healthy relationships to social media and with other kids. If you just touched on those 5 things for the average adolescent, the whole mental health space would just look completely different than it does right now. And I'm glad that, even though the word holistic makes me gag a little bit, that people are really working on identifying and targeting those topics more these days. And certainly addressing underlying trauma, whether or not it's coming from bullying, from issues that kids have been through things that have happened at home, things that have happened in their communities. Obviously we're living through what's going on in the Middle East right now. So really making sure that we're targeting these kind of things in treatment. Certainly working on the family system can be a huge source of support for our adolescents who are struggling with substance use disorders. And as I mentioned in the past, kind of addressing the impact of intergenerational and family traumas and how that's affecting the patient who's in front of us. And then actually I think kind of one of the most important parts is getting set up for the future, right? And what I hear from adolescents who've struggled with really severe substance use disorders is, okay, I'm sober, I'm even sober living at home, I'm not going out and acquiring substances, but I still feel like crap, right? And a big part of treatment is not just getting sober and staying sober, although that is a big part of treatment. It's setting up life to thrive and to have something that you're looking forward to. As one of my patients said, is like making a life worth being sober for. So I'd like to just really quickly thank SunCloud Health for letting me put on this webinar. This is an area that I'm really passionate about and care deeply about. Really appreciate Chris Hammond, who I mentioned, a titan in this space from Hopkins, for sharing some of his research, as well as Dr. Pohl at the Las Vegas Recovery for sharing some of their slides. All right, so you can certainly reach out to us and our wonderful outreach team, Sydney Pearson and Christy Orr, at those 2 spots below. Their phone numbers and direct emails are there. And then I am also going to remind you, in order to get your CMU credit, we are going to be sending you an attendance survey. Your completion of that survey is what will unlock that credit for you. So with that, thank you all so much for celebrating Veterans Day here with me today. I know many of you have the day off. I deeply appreciate you being here and taking the time to learn about this critical area. I am certainly happy to answer any questions that anybody's had over the course of our talking here today. Okay, first question I got, thanks for sending that in, is do you have any data about the use of CBD in adolescents? And then there's going to be a second follow-up question. CBD is even less well-studied area than THC. Cannabidiol products have a couple things that are going on. One is that for the most part, they are not produced pharmacologically, right? And so there are, I say for the most part because there are specific pediatric epilepsy syndromes. Lennox-Gastaut is one of them, and there's a couple others that actually do have evidence for purified pharmaceutical grade CBD, and they can be helpful in those very specific cases. Generally speaking though, CBD does not have huge impacts on the brain. If you take a look at the side effects, they're very minimal with it, at least from what we understand, although a few have started to come out and emerge, a couple potential negative concerns with CBD and issues with the cardiac system. But CBD is just, it doesn't have as large or anywhere near as large of effects as THC does on the body. It certainly has receptors across the whole body, and for the most part, we generally don't know what they do. The biggest risks with CBD in adolescents is probably not CBD itself. It's kind of making it seem that like marijuana products are like a good thing and medicinal, and B, the fact that most of them are produced, as I mentioned, not from an FDA certified place, and they have very high rates of contamination with THC, because you actually have to spend money, right, to extract all the THC off from the CBD, and it's easier to do that process with less safeguards in place. And so there have certainly been cases of family members giving their kids what they thought was CBD and ending up getting them intoxicated, which is kind of like a pretty scary place to be in, because CBD itself is not a psychoactive substance. Then the next part of that question is there any data involving titrating THC as a therapeutic intervention similar to ketamine? THC is very, very different than ketamine. Thanks for the question. Ketamine absolutely now has pretty robust data in its effects on improving depression in the adult population. We'll say its research in adolescents is very scarce. Ketamine's an intense intervention. It can cause dissociation. Long-term use can cause irreparable damage to the bladder, which is really scary when you see it. If you think like of peeing daggers the rest of your life, and it's completely unfixable. So there are certainly risks with ketamine, but it is absolutely something that needs to be part of the armament for depression, and there's real data behind it. THC has no data to support any help whatsoever for depression, and in fact, every study ever done on adolescent THC use has shown that it makes depression worse, and it makes depression dramatically worse. We're talking about hundreds % increase in incidence of depression, higher rates of suicidality and suicide. So it is, a similar question could be like, is there any data involving titrating methamphetamine as a therapeutic intervention similar to ketamine as far as like the likelihood of that being the case? Cannabis has been investigated for other conditions, PTSD, anxiety in the adult world, and honestly, most of those results are very negative as well. They typically find that you do exactly what you'd expect when you use consistent central nervous system depressants, which is you increase neural activity and you increase glutamate transmission, which makes those symptoms worse. Right? The brain is trying to maintain that homeostasis, and so when you push down with a brake over and over and over again, the brain pushes up with the gas, and then any time you don't have that brake applied, you're left with the excess neuroexcitatory or gas left over, which is a very unpleasant place to be in. And so, the research around using cannabis just for mental health in general in any population is very, very poor in basically every respect, and certainly in the adolescent population, the risk of harm just dramatically dwarfs what I could possibly imagine being any risk of or any potential for benefit. Thank you so much for that question. Somebody said, would it be possible for us to receive the PowerPoint? It was super helpful. I certainly have no problem with that. We can see what we can do to make that happen. And then the next part of that question is there an age that you might ask adolescents to abstain from before trying the products? That is a great question. The data on this is going to be a little bit lost to me because it's all going to be in the adulthood age. And as I mentioned, I am very focused on taking care of kids in high school and under, and not even into the transition age, young adulthood space. However, there is a lot of data to suggest that if your first use of alcohol, the later in life that is, it dramatically reduces the likelihood of having problems with alcohol. And in particular, people who are waiting to the age of legal alcohol use, 21, have almost a 0% rate of alcohol use disorder. It is profound, the data. Like if somebody told you could take this condition, that's occurring in high single-digit percentages and have like 100-fold reduction in the problem with it, if you waited from 16 to 21, man, I would buy the heck out of like a drug or stock or anything that could do that. And that's exactly what happens for people who are able to abstain. Now, there's of course co-founders of people who are willing to abstain until they're 21, have different brains than people who are not. And so 100% of that's not just from the abstinence, but that priming effect, that effect on that nucleus accumbens by avoiding substances of addiction early in life is really significant, and it's actually a bit under-researched. So if I had to give a suggestion to somebody, certainly into adulthood, I think 21 is much, much better. If you wait till 25, I think the likelihood that you're in the clear is virtually 100%. But it's always that thing, they're going to be around other people, and everybody has to make their own decisions. But certainly the high school age is just going to be wrought with landmines, and the longer you can wait, the better it's going to go. And in fact, if it's motivating for somebody that they can know when they're an adult, that they can unwind with, an edible or something like that after a long day at work, and really not have hardly any concerns associated with that, because because they waited, an extra 6-7 years to have THC available to them the rest of their life. Well, I'll tell you, no addictionologist on earth is going to tell you that, but if you had to tell somebody that, I would be okay with it. But so thank you for that question. Next one. What is an easy way to do the brain impact discussion with teens if we aren't able to say it like you did? Thanks so much for that question. So, I think the really important part is knowing your audience, right? If you've got kids who are really high achieving kids and are really looking to do stuff that requires a lot of intellectual horsepower, I do target, this is going to cost you RIQ points, just so that you know about that and you're aware, right? If you've got kids who are really into spatial things and things that are going to use their hands, they're big into construction, art, things like that. Talking about the deficits in that area is important. If you have people who have trouble with drive, with their get up and go, talking about those problems with executive functioning, task, completion and stuff like that might be where I would target it. And I think just overall making sure that people know, hey, you're an adolescent. Your biggest job right now is to develop an adult brain. You do that by making friends, pulling away from your parents, much to some of their chagrins, right? But that's part of what's going on. You identify who you are by spending time with other peers your age. Their personalities help you form your personality, and that is a very complicated process inside the brain that needs calories, and it needs to not be impacted by things that are affecting the neurogenesis and the pruning of the brain. And this is absolutely one of the most dangerous things that you could be doing to impact that, right? If you ask the average adolescent, a lot of them will tell you alcohol is way worse for you than cannabis. Even if you ask a lot of parents, they'll say the same thing. The data behind long-term harms to the brain from alcohol is basically non-existent for adolescents. You have problems with addiction, and alcohol causes a ton of problems. I don't want to downplay any of those, but the long-term developmental impacts on the brain, cannabis is one of the worst substances you can imagine. In fact, I don't know of any other substance that causes more harm to the development of the adolescent brain. And so I think just getting those big points out can make a big difference. Thanks so much for the question. Next question. Can you speak on the medical cards and your thoughts on this avenue of cannabis acquisition, which I know teens talk about? Yeah, so same thing as before. The medical benefits of cannabis in adolescence is basically never the case where the benefits should outweigh the risks. Honestly, when I see any doctor who's even thinking about doing that, I get this gut reaction to report them to the medical board. I actually think it is malpractice in most instances. Now, if somebody has some crippling physical malady, by which cannabis is something that makes more sense than, for example, being on opioids, I'm not going to opine about that. I'm not a pain specialist. I'm not a neurologist or rheumatologist. And there could be some instances in which hey, there are really significant risks to this, but it is still better than the alternative, and I could buy that. Right, but if you're talking about using cannabis for any psychiatric disorder, you're talking about 100% increase in rates of depression, anxiety, double-digit increases in rates of suicidality. You're costing them IQ. You're costing them long-term abilities with executive functioning. I mean, you couldn't come up with, I don't think, any benefit on earth that would even come close to the cost that adolescent cannabis is costing individuals who are going to use it on a medical regular basis. Most medical use is like a daily basis use cannabis, which is where we have the biggest problems. So I omitted some of the slides, but it's everything I said and even worse is what the data shows. So thanks so much for that question. Next question. I really appreciate all the questions coming in, by the way. Do you think THC can actually be useful for PTSD? Yeah, it's a great question. When that was a big deal, right? Veterans have been a big part of the legalization efforts. They've used, poor veteran who, and honestly, on today, obviously, thanks so much for your service, and oh my God, the horror of war. I worked in the VA at Jesse Brown as a resident for years, and just untold horror to their brain. And so obviously anything that can be done to improve PTSD, big game. But let me tell you about PTSD real quick. First of all, we have extremely good treatments for PTSD. They're just very unpleasant to do. And so making sure that people who have severe PTSD are connected with actual evidence-based people who know how to do real, prolonged exposure and trauma-focused CBT, that's big game. Right? Everybody wants a drug to do it, but the drugs are not going to be as good as the therapy anytime in the near future. The second thing is most of the studies that have come back have shown that PTSD symptoms are not improved, and in some cases worsened by using cannabis, and that's in the adult population. Do I think that maybe there's some way that you find one of the THC that's not Delta 9, but one of the other 80 psychoactive compounds, and that gets isolated and maybe is less harmful 20 years down the road? I could totally see that, but we are a long, long way from that. And using just straight Delta 9 THC for PTSD is a little bit like using Xanax, right? I mean, the goal is to just kind of blast your brain such that you don't have these things, and it doesn't actually deal with or address any of the horror and trauma that you've been through. If that's what you need to get through the day, I think that's a conversation for adult psychiatrists with, folks who are dealing with really severe symptoms and might otherwise, end their life. But I think you're almost in the stage of like needing palliative, kind of treatment of PTSD and saying like, I'm just giving up on the treatment of this disorder. All we can do is palliate symptoms. We're never going to have a life of recovery if you're getting to that point. It's a great question. Thank you for that one. Next one, can we reach out to SunCloud if we have questions about the tools that are available for social workers to build awareness? You absolutely can. Both those emails up there are great people to connect with. I am always happy to talk about this topic. If you can't tell, this is one of the areas that is most near and dear to my heart, and I'm very happy to be involved in those things as well. I do have a little one at home and a very busy wife as well, but I am really happy to talk about this topic pretty much anywhere and everywhere. In fact, I'm going out to give 2 talks next week about the same thing. So if we can be of assistance and help form that phalanx around our youth and help fight this back and give them a fighting chance in this world, I'm more than happy to be involved. Great question. Thank you. Next question. In a teenager mind, it's legal. What messages you found that really reaches them where they are? Yeah, like I said, I think the legalization part, one of the most harmful things is this idea that because it was legalized in adults' usage, that it's just not a big deal. It's like, going to the store and picking up an energy drink, right? And I think it's a very individualized thing. I think for some people who are really rule followers, just making sure they know what's at stake for them. If all of a sudden tomorrow we legalized fentanyl, methamphetamine, PCP, does that mean you're going to do it? Because there are plenty of states that have decriminalized these drugs. It's I think an important thing to say, like what is going on with the industry and the lobbying in Congress is just really removed from medicine. And if I had to say one thing that really resonates with a lot of my teenagers, it's that this is just big tobacco morphed into big cannabis, right? And the average adolescent, they understand like what's happening in their life because of these megacorps and later stage capitalism and what that's doing to the world. And most adolescents are not a big fan of shoveling their money into them and kind of promoting this further. So I say, take a look at Washington, go look at what's happening with lobbying, see who's making the real money here, and that'll lead you to any of the conclusions that you really need to know. Great question, thank you. I would literally stay for another 5 hours and talk. I am sure many of you have other things you need to do. So thank you all so much for coming. I really appreciate the lively Q&A. It's always hard to do when it's remote, so I appreciate you doing that. Please let us know if there's anything we can do to help, and if you have adolescents in your life who are struggling, please help them get some help and turn things around. Thanks so much, everybody. Have a great rest of your day.